this legislation. I appreciate Dr. Murphy's leadership on it. I'm proud to be an original co-sponsor because I think this is an important bill in the context of the special status that we grant nonprofits, which we've done for a long time from the IRS code, from the tax code. We grant nonprofit status and forgiveness on taxes in exchange for a public benefit provided by that organization. We've seen over the past few decades a large growth in the number of nonprofit organizations. They are now about 5% of the total GDP, economic activity, employ over 12 million individuals. And so I think it's incumbent on this committee to revisit that relationship and that benefit on a periodic basis, and particularly as it relates to nonprofit hospitals. Again, we have provided enormous tax advantages in exchange for an expectation that they'll provide meaningful charitable benefits to their communities. And I'll repeat what Mr. Murphy had said. Many hospitals do that, particularly rural hospitals, critical access hospitals, safety net providers. But we have to also look at the total landscape and realize that it looks very different than it did when many of these tax policies were created. We now have large nonprofit health systems that have become very sophisticated, multi-billion-dollar enterprises. We've heard they own investment portfolios. They're certainly acquiring many physician practices. They advertise extensively. And in many cases, they operate very similarly to their for-profit competitors. A few weeks ago at the hearing here with multiple hospital CEOs, I asked the CEO of the nation's largest for-profit hospital system whether he believed that there was a meaningful difference, operational difference between for-profits and some of the nonprofit hospital systems that were represented there. And his answer was really simple. It was just, the short answer is no. He doesn't see a meaningful difference. And so if taxpayers are providing more than $37 billion annually in tax benefits to nonprofit hospitals, and it'd be roughly 260 over the next decade, Congress has an obligation to understand what taxpayers are receiving in return. And I think that's exactly what this bill does. To be clear, it doesn't revoke anyone's tax-exempt status. It simply asks hospitals to show their work. It requires more meaningful reporting on charity care, financial assistance, spending to address community health needs, advertising, health service lines, participation in the 340B program, with reporting broken down by individual hospital facilities instead of massive system-wide aggregates. And so this, in my view, really shouldn't be, this is transparency that shouldn't be controversial. If nonprofit hospitals are delivering extraordinary value to their communities, then this legislation will help them demonstrate that. And if taxpayers are subsidizing activities that do not advance charitable care, then Congress should know that as well. I think good policy begins with transparency and good information. So I again thank Mr. Murphy for leading this effort. I urge my colleagues to support this bill, and I yield back, Mr. Chairman.
Thank you. I recognize Mr. Thompson for 5 minutes.